So, Dr. Munshi, thinking about CAR T cell therapy, are there any side effects associated with this therapy and how do you control or prevent these?
So CAR T cell is connected with significant side effects, serious side effects. And the one most feared and or prominent is the cytokine release syndrome. So when the T cells bind to the tumor cells, there is a tremendous expansion of T cells, almost thousandfold or more. And this expansion leads to production of number of molecules, cytokines and chemokines. And those molecules cause side effects. One of the most common and important such cytokine is interleukin 6, IL-6. We can measure IL-6, and we do measure it from time to time, but indirect measurement of IL-6 production, which indirectly suggests how much T cell is expanding, is through measuring C-reactive protein, which is one of the standard lab tests. So in a given patient, when patient gets the CAR T cells and the T cell expand, we monitor the CRP level to see how much interleukin 6 is being produced, and also indirectly T cell is expanding. So for example, in this given patient, following infusion of CAR T cell, there is a tremendous increase in CRP. That tells us that T cells are expanding. But this IL-6 also leads to fever. So the increase in CRP also most of the time matches patient getting fever and sometimes high fever, 104, 105 fever. And this is classic presentation of cytokine release syndrome. In the early stage, we don't have to treat except treating fever. However, when the CRS leads to other organ dysfunction, when pulmonary problem, cardiac problem, or neurotoxicity, that's when we need to intervene because it's a serious, sometimes life-threatening side effect. And the best way to treat is to target the interleukin 6, which is causing all the problem. And so patients can be treated with an anti-IL-6 antibody. It can be anti-IL-6 receptor antibody or IL-6 antibody called tocilizumab or siltuximab. And by giving this antibody, we can very quickly suppress the IL-6 activity. In fact, the CRP goes down very precipitously, and patients' fevers go away, and they improve quite significantly. So we need to treat the cytokine release syndrome quite aggressively when there are other body dysfunctions.
And how common is it to use multiple therapeutics to treat this condition?
So in myeloma, we have very good data that 2-drug regimen work better than 1, and 3-drug regimen work better than 2. So we almost always combine multiple agents. Even when we are looking at new drugs, we combine with some of the old drug. And the concept is that the 2 drugs we combine synergizes each other. So a drug A helps drug B work better, and drug B helps drug A work better. In our case, say for example, lenalidomide is one of the drug, and bortezomib is another drug, very standard drug. They help each other work better. So when we give them together, they really have a great response. In fact, this combination we call RVD works 100% of the time. So when we see patient, we can really say that you're almost 100% going to respond to this drug. Now, CAR T cell is unique in certain ways at the moment, that when we give CAR T cell, we give it as a single infusion. So currently, the plan for myeloma in this particular study is to give one single infusion of CAR T cells. Even with that, we have incredible responses, and that's very exciting. However, I do envision that over time, we may combine it with something else, because our hope is to cure the cancer. And CAR T by itself may or may not do it. Even if it does it will be small proportion, not everybody. And so we need to improve its efficacy.